My name is Kayla Cox, Kayla and my client is Dr. Randy Norman, RandyNorman, and he's 42 years old. The differential diagnosis is somatic symptom disorder and illness anxiety disorder. Somatic symptom disorder was ruled out because his symptoms, including chronic anxiety, are better explained by illness anxiety disorder. The diagnostic features of illness anxiety disorder are preoccupation with acquiring or having a serious illness, engages in excessive health-related behaviors or avoids medical care, and extreme anxiety about health status and becomes easily alarmed about health. I will now tell my client's story. He is a medical internist who was referred for evaluation by his gastroenterologist, who after extensive testing found nothing medically wrong with him. Nevertheless, Randy firmly believes that his minor symptoms of abdominal cramping, gas, and bloating are an indication that he has an abdominal mass that may be cancer. Randy previously went to 2 other gastroenterologists who also found that he had a normal abdomen. Various tests that were done included X-rays and abdominal CT and stool testing. None showed an abdominal mass or rectal bleeding. But Randy is still not convinced that he is healthy. His constant worry about his health is impacting his life. His wife has become dissatisfied with the state of their marriage. She can't enjoy free time with him because he spends it all obsessed with his various physical complaints, reading and rereading his medical books for answers, and taking to his sick bed. Randy has been preoccupied with his health since the age of 12. This began after his older brother collapsed and died during a basketball practice. The autopsy showed that his brother had an undiscovered congenital heart defect. When Randy was evaluated as a child, he was given a clean bill of health from the cardiologist. His preoccupation with his health that began at this time led to his decision to become a doctor. Now, the multi-axial diagnosis is axis 1, illness, anxiety disorder. Axis 2 is none. Axis 3 is benign heart murmur. Axis 4 is marital strain. Axis 5 is a GAF score of 70. And there are 3 theoretical perspectives that are relevant to this case. First, the cognitive perspective. Randy's symptoms may be due to irrational beliefs and the misinterpretation of bodily sensations. His fear of becoming seriously ill fuels hypervigilance for signs that he is developing a medical condition. Next, the biological perspective. The client's symptoms may be due to an overactive sympathetic nervous system that leads to chronic anxiety. This chronic activation results in the stress hormone cortisol being secreted, along with excess levels of norepinephrine and deficit levels of GABA. Finally, the behavioral perspective. Randy's symptoms may be due to the faulty learning experience of classical conditioning. As a result of his brother's death, he made a stimulus response association between death due illness and his fear of that occurring for him. This led to operant conditioning. His hypervigilant behavior gives him a false sense of control that negatively reinforces this behavior. That concludes my presentation.